If I can just ask you, well, let me first say that why we enjoy doing this with you is because you are doing it quietly, but I don't think we feel you can inspire other companies to do similar, social work. And you're doing it selflessly, you're not trying to make money out of it, and we are basically publicizing it only because it can make others do the same. In fact, you do it so much, he even got COVID, just as part of his work. So the motivation behind this, I mean, you've got financial responsibilities elsewhere, but there is a depth that this comes which inspires us, and I think tell us a bit about where this motivation comes from.
I think, thank you for so much, Dr. Roy, for saying that. I think for us, I think it goes back to the core belief for Reckitt, which is that we believe that the right to nutrition, health and hygiene should not be a privilege, it's a right, right? And it should be therefore accessible to everyone. And on Dettol, we've been living that for the past 85 years, where we've been trying to inculcate an understanding of hygiene and basic healthy habits. Right. And to me, that manifestation of that takes different forms, right? Whether it is our products, we have a whole portfolio of products when it comes to specifically, we were talking about hand hygiene and the importance of hand hygiene. Right. We have a plethora of products that can be accessible. We just actually launched a 10 rupee product, which is a powder, which converts into a hand washing liquid to make it accessible and available to everyone. The other part that we try to do is to make the products available to more and more markets. So we are, millions of stores where our products are available become access points for that. And the third thing that we obviously do is communication, right? Where we've been for the past 2 decades talking about specifically hand hygiene, because that is something that, we know hands are very important. They become a source, especially in a country like ours where we use hands as a primary source of eating, become a source of major illnesses. And I think that's something that we are seeing, that there has been a big change in habit, especially during the pandemic, and it is stuck. And we take a lot of pride individually in the efforts that we are making and in the impact that that's having. And I think that is slowly also spreading to others, especially in the fraternity that I work with. There is a lot of recognition of the work that we are doing, and we hope that more and more of this kind of work will happen, which will lead to, in the next 75 years of this country, lead to even more change than what we have seen so far.
Right. Excellent.